In the last video, we covered the diagnostic criteria for conduct disorder. In this video, let's look into some of the specifiers that we can use for this diagnosis, as well as some of the risk factors that we know exist for conduct disorder. But first, my name is Keegan. I have a master's degree in counseling and I'm a licensed professional counselor. I make videos like this to help you better understand the world of counseling, psychology, and mental health. When it comes to the specifiers for conduct disorder, we can break these up into three main categories. As a quick reminder, many diagnoses have specifiers. Specifiers are ways of noting additional information about a diagnosis that might be relevant to other people who are working with this person and the diagnosis that they have. With conduct disorder, the first area of specifiers relates to the onset of symptoms. In this category, there are three specifiers for conduct disorder. The first is childhood onset, second is adolescent onset, and third is an unspecified onset. For the childhood onset specifier, this would mean that at least one symptom was present before the age of 10. For the adolescent onset specifier, this means that there weren't any symptoms before the age of 10 and that the symptoms began to appear after that age. In some cases, it might not be easy to determine whether the symptoms began before or after the age of 10. And in situations like this, we can use the specifier of unspecified onset, meaning that we couldn't determine when the symptoms began. The next specifier that we're going to look at is if the client shows limited prosocial emotions. For this specifier, we're going to look at things like lack of remorse or guilt, if the client appears to have a lack of empathy, if they're unconcerned about their performance, such as in a school setting, or if they have a shallow affect, meaning that they don't really express or show emotions in the way that we would expect, or if the emotions that they express seem to be shallow, insincere, or superficial. For a limited prosocial emotion specifier to be used, this means that the client would show two or more of these characteristics within a 12-month period. The last area of specifiers is related to the severity of the conduct disorder. For conduct disorder, we can rate it as mild, moderate, or severe. For mild severity, this is when the client has few, if any, additional criteria that they're meeting beyond what is necessary to diagnose conduct disorder. Mild severity is a bit vague because they say that for mild severity, the person has to have more symptoms than would be considered mild, but not as many symptoms as would be considered severe. So I have a way that I like to think about this that we'll get to after we talk about the severe severity. For the conduct disorder to be considered severe, this would mean that they have many symptoms in excess of what is needed to diagnose, or that they're causing harm to others. As I mentioned, the severity specifier is a bit vague at times, as they don't say exactly how many would be considered mild, moderate, or severe. They just leave it up to professional judgment, which is okay. But I often like to have a little bit more structure to things to be more consistent. A way that we could think about this is because conduct disorder needs at least 3 symptoms to meet the criteria for the diagnosis, somewhere between 3 to 5 symptoms we may consider mild. If the person has 6 to 10 symptoms, we may say that this is then a moderate severity. And if the person has somewhere between 11 to 15 symptoms that they're meeting, this would be considered severe. Also, if part of the conduct disorder is that they are harming other people, that would then automatically bump it up to a severe conduct disorder. Now that we've talked about the specifiers for conduct disorder, you might be wondering what some of the risk factors are that would increase the risk of conduct disorder for somebody. We'll cover those next. But first, if you're enjoying this video and finding it helpful, please help me out by giving it a like and subscribing. For conduct disorder, there are multiple things that can increase the risk of developing a conduct disorder. However, there is nothing that we can say for sure will cause a conduct disorder. More so, we just see that there are some things that increase a person's risk. Keep in mind though that just because somebody has had one or more of these risk factors that they've experienced, that doesn't mean that they're going to develop a conduct disorder. It just means that their risk is increased. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition text revision, there are many things that can be risk factors for conduct disorder. This includes that if somebody has a temperament as a child that was not well controlled, this would be the first risk factor. Other risk factors include lower than average intelligence, rejection from parents, neglect, inconsistent parenting or child rearing, experiencing harsh discipline methods, physical or sexual abuse, lack of supervision, being institutionalized earlier in life, coming from a large family, criminal behavior by parents, having parents with substance use disorders, having a biological parent with a conduct disorder, meaning genetic factors might be at play, or having a biological parent with an alcohol use disorder, depressive disorder, bipolar disorder, schizophrenia, or ADHD. It's important to keep in mind that this is not a complete list of risk factors for conduct disorder. But I do think that this list highlights the wide variety of things that could be risk factors for this diagnosis. Remember, just because somebody has one or more of these risk factors does not mean that they're going to develop a conduct disorder. And likewise, somebody could have a conduct disorder diagnosis and never experienced any of these risk factors to begin with. I hope that you found this video on the specifiers and risk factors of conduct disorder to be helpful. While you're here, make sure that you check out some of the other videos on my channel. Thank you so much for watching, and I'll see you in the next video.